my message to people and the families who have persons suffering from epilepsy. Epilepsy is a disorder of the brain. It is seen in about 1 in 150 to 1 in 200 people all over the world. India, being a very populous country, accounts for a large number of persons with epilepsy, and therefore 1 in every 5 persons with epilepsy in the world may be an Indian. Now, what causes epilepsy? Epilepsy is a disorder of the brain whereby the brain cells or neurons suddenly, excessively and without any provocation start firing with high voltages, and when many neurons fire together, it may cause disruption in brain function. We call this disruption of brain function a seizure, and alternatively people call it fits, and in the vernacular there are several names depending on which area of India you come from or which area of the world you come from. But in short, when a person gets a disruption of brain function, he may lose consciousness, he may become blank, he may fall down, he may be blank, unresponsive, he may clench his teeth, he may stiffen his limbs and jerk them, and this is what becomes a very scary thing to look at, and people get alarmed. No wonder people have discriminated against people with epilepsy because of this sight that is so frightful to people. And there have been a lot of myths about epilepsy, because of which there is a lot of stigma and ostracism of people with epilepsy. Now, epilepsy is actually a disorder of the brain. It is not caused by God's wrath or something that affects is affected by nature. And as people thought that if you sit next to a person with epilepsy, you will also get epilepsy. You cannot eat from in the presence of a person with epilepsy, and because of this somebody else will also start getting epilepsy. All these are, and many more myths are there, because of which people go and have abnormal practices, especially from faith healers, and this does not really solve the problem. So there are many causes of epilepsy. Only about 20% or so may be hereditary or genetically induced. Most of them are caused by either brain infections, brain injury, birth asphyxia, infections of the brain during childhood, head trauma, sometimes tumors of the brain, and so on and so forth. And these can be very easily sort of detected by some medical tests. If you go to your doctor, he may do an EEG, which is a measurement of the electrical activity of the brain by applying small electrodes to the head, and this takes about half an hour to find out whether the patient's brain is excessively firing or not, and whether the person has epilepsy, and whether the epilepsy is beginning from a focal area of the brain or from the entire brain, which is called the generalized epilepsy. Sometimes the doctor may want to do a scan of the brain where you can actually see a structure of the brain, and various cuts of the brain are taken in this scanner. It's something like seeing the brain from inside without having any harm being done to the patient. And this gives a lot of insight into what causes epilepsy. And epilepsy, when it is caused by a single focus in the brain, usually has very focal symptoms. So you have either a twitching of the hand or some kind of a sensation. But sometimes the epilepsy starts as a generalized, beginning from the entire brain, in which the person really loses consciousness. About the treatment of epilepsy, anti-epileptic drugs need to be given when a person has 2 or more fits. That is when we call it epilepsy. A single fit may not be epilepsy. Unless a person is predisposed to getting a second fit, we do not start him on medication, nor do we label him as epilepsy, for simple reasons that they may be discriminated against. Having made the diagnosis of epilepsy and maybe investigated it with these modalities, we start on anti-epileptic drug treatment. It's usually begun with one medication given once or twice a day, sometimes 3 times a day, and this has to be taken regularly for at least a period of 2 to 3 years. Very regularly. One must not miss the dose to get good effect. If there are no seizures for 2 years on medication, the medication may be gradually withdrawn and most of the people respond to this. Almost 70% of persons with epilepsy respond to a single anti-epileptic drugs. At the end of treatment of 2 or 3 years, almost 80% or 85% of patients may be controlled and often cured of epilepsy. For patients who do not respond well to medication, there is another alternative. For patients who have a focal circumscribed area of brain abnormality, may be worked up to find out whether this patient is amenable to surgical removal of that abnormal part. And once we actually determine by doing a few tests, such as video EEG and some other scans, specialized scans, we know that the seizure comes from that abnormal part of the brain, and we are sure that it is not around very important areas like memory, speech or motor activity. It's then we can advise the patient carefully to do a proper removal of that part. Scientific advances have taken place in the field of epilepsy, and we can offer a lot to patients. The problem is there is a large treatment gap. Patients do not come forward for treatment because of this myths related to epilepsy, because of stigma, because of ostracism, and therefore they lose out a lot of important aspects of their lives, and a lot of families have to suffer. If the patients come forward for treatment, we can actually make a change in their lives, and therefore the slogan today is "Be the change." Spread the word for people to come forward for treatment of epilepsy, and do not discriminate against people with epilepsy. Help them to come forward for treatment. That is what we want to see.